a lot of the deaths have been attributed to using these conversion tables and starting patients on too high of a dose.
Prescriptions are accidentally killing patients by the thousands each year. A Utah expert says because doctors are calculating the dose with standard reference tables that are wrong.
In fact, I call them the death table.
Good evening. Thank you for joining us. The disturbing new study by 2 Utah experts gives inaccurate reference tables part of the blame for the rising death toll from prescription painkillers.
It's now 15,000 deaths a year. Science and Nature specialist John Hollenhorst joins us with the exclusive story in the newsroom. John.
Well, Keith, when a patient switches from one painkiller to a different one, how does the doctor know what a safe dose should be? Well, usually they'll turn to a reference work like this. It's called a conversion table. So this one's on the internet. It's a standard tool, but the new study says that all too often these conversion tables get the prescription wrong with deadly consequences. It's common for patients to switch from one painkiller to another.
For a lot of reasons. Nausea, vomiting, they develop a tolerance to it. It just loses its effectiveness.
Or, Dr. Lynn Webster says, the switch is necessary because the insurance company won't pay for the more expensive drug. But that simple switch can be deadly, according to the study Webster just published with Dr. Perry Fine of the University of Utah. The annual death toll from drug switching errors is hard to quantify.
I think it could be thousands nationally for sure.
When changing a patient from one painkiller to another, the doctor typically figures out the proper dose by consulting published conversion tables that give equivalent dosages.
We've been taught that these equal analgesic tables are reasonably safe as a guide, and they're not.
He says the conversion tables are notoriously inaccurate. Many doctors already cut the supposed equivalent dosage by half or 3/4.
And even then, it can be lethal with some individuals.
It's not just drug addicts or chronic long-term pain patients who are at risk.
It could be somebody who's been on a pain medicine after a hip operation or after a knee operation for several weeks, and it's not working anymore.
The conversion tables were never scientifically based, Webster says, even though the FDA and drug companies have urged doctors to use them. Webster recommends abandoning the tables. Prescribing doctors should just gradually phase out one drug and phase in the other.
And that's why we're basically on a campaign nationally to make sure that every physician who prescribes an opioid understands they can't use these conversion tables.
Well, the study is likely to cause a bit of a stir in the medical profession because of the prominence of the 2 co-authors. Dr. Webster is president-elect of the American Academy of Pain Medicine. Dr. Fine is the immediate past president. Back to you.
Kind of disturbing news there. Thank you, John Hollenhorst, tonight.